Ever feel like you're just drowning in medical information? You want to understand something important, but you just get lost in all the technical terms.
Absolutely. It's easy to feel overwhelmed.
Yeah.
You just want the key facts, right? The essential understanding.
Exactly. And that's what we're aiming for today. We're doing a deep dive into aplastic anemia.
Sometimes called aplastic pancytopenia, too. It sounds complicated, but we'll break it down.
Right. So what sources are we working with here?
We've got some really interesting excerpts, mainly focused on how this disorder shows up in animals like dogs and cats.
Okay, so studying it in animals can give us some good insights.
For sure. It helps us understand the fundamental biology.
Great. So our mission for you listening is to get a handle on what aplastic anemia is, what might cause it, how vets figure it out, and what the outlook might be, all without the heavy jargon.
Let's do it.
Okay, so first things first. What is aplastic anemia, basically?
Well, at its heart, it's a problem with the bone marrow. The bone marrow is like the body's factory for making blood cells.
The blood cell factory, right?
Yeah. And in aplastic anemia, that factory floor, the active marrow tissue, it gets replaced by fat tissue, adipose tissue.
So fat moves in and blood cell production goes down.
Pretty much. It seriously hinders the ability to make those essential blood cells.
And this leads to something called pancytopenia. That sounds significant.
It is. Pan means all, and cytopenia means a shortage of cells. So pancytopenia just means you've got decreased production across the board.
Across the board. So all the main types.
Yep. Red blood cells, they carry the oxygen. White blood cells, especially the ones called granulocytes that fight infection. And platelets, which you need for clotting. Fewer of all of them.
Got it. Okay. Now, the sources mention acute versus chronic forms. What's the difference there?
That's a key point. In the acute or sudden form, you tend to see the effects of low white cells, that's neutropenia, and low platelets, thrombocytopenia, pretty quickly. These cells just don't last long in the blood anyway.
So the problems show up fast.
Right. The signs you see are directly related to those immediate shortages. Now, in the chronic form, you might still see those acute signs, but you also develop something called non-regenerative anemia.
Non-regenerative anemia. So the body isn't making new red blood cells properly.
Exactly. The bone marrow just isn't keeping up with replacing the old red cells that get removed naturally. So you get anemic over time on top of the other issues.
Okay, that makes sense. Acute is fast-hitting low white cells and platelets. Chronic adds in that slow decline in red cells, too. The sources also hinted that the immune system might be involved, like it's an immune-mediated thing sometimes.
Yeah, that's often suspected. It means the body's own immune system might be mistakenly attacking those stem cells in the bone marrow, the very cells that are supposed to grow into new blood cells.
So friendly fire, essentially. The body attacking itself.
Sort of, yeah. Why it happens isn't always clear. It's complex. But this idea of a misguided immune attack is definitely a big part of the picture in many cases.
Okay, so we know what it is, this bone marrow failure. Who typically gets this? Our sources focused on animals, right?
Right, primarily dogs and cats in the material we looked at.
Any particular breeds or male versus female?
Interestingly, no. The sources didn't point to any specific breed or sex being more likely to get it. Although there was one study mentioned that found the average age in affected dogs was about 3 years old.
3 years. That seems quite young for such a serious condition.
It does, yeah. It's just one data point, of course, but it's an interesting detail, maybe not what you'd immediately expect.
Definitely not. Okay, so if an animal does have this, what signs might you actually see? Let's start with that acute form again.
With the acute form, think about those low white cells and platelets. Low white cells, specifically neutrophils, means the immune system is weak, so you might see a fever, a sign of infection taking hold.
Okay, fever. Makes sense.
And the low platelets, that affects clotting, so you might see petechial hemorrhages.
Petechiae, what are those exactly?
They're tiny, like pinpoint-sized, red or purple spots.
Yeah.
You might notice them on the gums or maybe on the skin, where there isn't much fur.
Little bruises almost.
Kinda, yeah. Caused by tiny bleeds under the surface. Other signs of poor clotting could be nosebleeds, that's epistaxis, or blood in the urine, hematuria, or even melena.
Melena.
That's dark, terry-looking stool. It usually means there's bleeding happening higher up in the digestive system. All pretty serious signs related to that lack of platelets.
Definitely concerning. And what about the chronic form? What signs emerge there?
With the chronic form, that non-regenerative anemia becomes more noticeable. So signs related to not having enough oxygen carriers, the red blood cells.
Like being tired?
Exactly. Weakness, lethargy. You might also notice their gums or the inside of their eyelids look really pale. pale mucous membranes.
Because there aren't enough red blood cells to give them that normal pink color.
Precisely. And remember, animals with the chronic form can still show those acute signs too. The fever, the bleeding issues, it can be a mix.
Right. It paints a picture of a body really struggling. So let's talk causes. What actually triggers this? The sources said it's often unknown.
Yeah, that's a key takeaway, honestly.
Yeah.
In many, maybe even most cases, a specific cause is never identified, which can be really frustrating.
I can imagine, but there are known potential causes, right?
Yes.
Categories of things?
Yes, definitely. The sources lay out a few main categories. First up, infectious agents.
Infections. Like what?
Well, in cats, things like feline leukemia virus,
Yeah.
FLV, or feline immunodeficiency virus, FIV. Both dogs and cats can be affected by parvoviruses.
Huh?
And then there are rickettsial organisms like Ehrlichia,
Ehrlichia, isn't that tick-borne?
often, yes, transmitted by ticks.
Mhm.
So various viruses and bacteria that can somehow disrupt what's happening in the bone marrow.
It's sobering how an infection can hit such a fundamental process. Okay, what's the next category? Drugs and chemicals.
Right. And this list is, well, it's pretty long and diverse.
Uh-oh.
Yeah, estrogen is mentioned either given as medication or sometimes produced by certain tumors. Then there are chemotherapy drugs, which makes some sense, as they target rapidly dividing cells, and bone marrow cells divide rapidly. Drugs like azathioprine, cyclophosphamide, several others.
Chemo drugs, got it. What else?
Certain antibiotics, trimethoprim sulfa, cephalosporins, chloramphenicol are listed. Even some antifungals like grisofulvin.
Wow, even common antibiotics.
Potentially, yes. Also some NSAIDs, non-steroidal anti-inflammatory drugs like phenylbutazone, and even some antiparasitics like fenbendazole and albendazole.
This list keeps going.
It does. Captopril, a blood pressure drug, quinidine for heart rhythms, thiacetarsamide, an old heartworm treatment. Exposure to ionizing radiation is another one. And in cats, even mycotoxins, toxins from molds are mentioned.
That is quite a list. It ranges from cancer treatments to common meds to environmental toxins.
Exactly. It really shows how sensitive the bone marrow can be to a whole host of different substances. Things given intentionally, things encountered accidentally. It highlights how careful you need to be.
It really does. That estrogen point you mentioned earlier from external sources or tumors, anything more to add there?
Just that it emphasizes how hormonal balances are critical. You know, messing with hormone levels, whether intentionally with medication or unintentionally because of a tumor, can have these unexpected knock-on effects on something as vital as blood production.
A delicate balance, for sure. Okay, so we have these potential triggers. How does a vet actually diagnose aplastic anemia? It sounds tricky if the cause is often unknown.
It is tricky. A big part of the diagnostic process is actually ruling out other things that can cause pancytopenia, that shortage of all blood cells.
Other things besides aplastic anemia.
Right. Because some conditions might cause low blood counts, but the bone marrow itself might actually be working overtime. Or it might be crowded out by abnormal cells. Things like myelodysplastic syndromes, leukemia, or even myelofibrosis, where the marrow gets scarred.
So you have to rule those out first.
Yes,
Yeah.
you need to confirm that the problem really is the marrow not producing cells, rather than some other issue causing the low counts.
Okay, so what do the standard tests, like blood work, usually show if it is aplastic anemia?
The CBC, the complete blood count, is key. You'll typically see leukopenia, low white blood cells, especially low neutrophils, often low lymphocytes too, so lymphopenia.
Low infection fighters.
Exactly. Then you'll see that normocytic, normochromic, non-regenerative anemia we talked about.
Right, red cells look normal individually, but there just aren't enough new ones being made.
Correct. And almost always you'll see thrombocytopenia, a low platelet count. Seeing all of those together, low counts in all three lines. Plus, the non-regenerative nature of the anemia points strongly towards aplastic anemia.
That combination is the big clue. Are there other lab tests that help?
Yeah, definitely. To look for those infectious causes we mentioned, vets might run immunologic tests, things like titers, ELISA tests, IFID tests looking for antibodies or bits of the infectious agents.
Checking for past or present infections.
Right. And PCR tests can be really useful too,
Yeah.
looking directly for the genetic material of viruses or bacteria. And sometimes a Coombs test might be done. That checks if the immune system is attacking red blood cells, which isn't the main issue in aplastic anemia itself, but it helps rule out other types of anemia.
So, lots of tests to narrow it down and check for underlying causes. What about looking directly at the bone marrow? The sources mentioned aspiration and biopsy.
Yes, that's often crucial for a definitive diagnosis. Bone marrow aspiration is when you use a needle to draw out a liquid sample of the marrow.
Like sucking out some of the liquid marrow.
Kinda, yeah. But the problem in aplastic anemia is that the marrow is often replaced by fat. So when you try to aspirate, you might just get a fatty sample or very few cells. It's often non-diagnostic or inadequate.
Not very helpful then.
Not always, no. That's where the bone marrow core biopsy comes in. It's a bit more involved. You take out a tiny, solid core of the bone marrow tissue itself.
A solid piece.
Yes. And that lets the pathologist look the actual structure, the architecture of the marrow under a microscope.
And what do they see in aplastic anemia?
They see marked hypoplasia, meaning very few blood-producing cells from all the different lines, and they see that the normal marrow space is largely replaced by fat cells. Seeing that structure confirms the diagnosis. The biopsy gives you the bigger picture that the aspiration might miss.
Okay, the biopsy is really key for seeing that fatty replacement. So once it's diagnosed, what's the treatment plan?
Treatment is often heavily focused on supportive care, managing the consequences of having too few blood cells.
Like dealing with the symptoms.
Exactly. So antibiotics are really important, especially if there's fever, to fight off or prevent infections because the white blood cell count is so low.
Makes sense.
And blood component therapy is vital. That means transfusions. If the anemia is severe, they'll need red blood cell transfusions. If the platelet count is dangerously low and there's bleeding, they might need platelet transfusions.
Tailoring the transfusions to what's needed most urgently.
Right. It's about supporting the patient through the crisis while you hope the marrow can recover, or while other treatments potentially take effect.
Are there drugs used to actually treat the underlying marrow failure?
The main one mentioned in our sources is cyclosporin A.
Cyclosporine.
Hmm.
Isn't that an immunosuppressant?
It is. The idea goes back to that potential immune-mediated cause we talked about. If the immune system is attacking the marrow, then suppressing the immune system with cyclosporine might allow the marrow to recover. Specific doses for dogs and cats were mentioned.
So trying to stop that friendly fire?
That's the rationale, yeah. The sources also noted that some other approaches hasn't been very successful. Things like hematopoietic growth factors, drugs meant to stimulate blood cell production, generally haven't worked well for this specific condition. And things like androgens or corticosteroids also seem to be largely ineffective, according to the material.
So it's mainly supportive care plus cyclosporine in many cases.
That seems to be the primary approach outlined, yes.
Yeah.
Supportive care is critical regardless.
And how closely do these patients need to be watched?
Very closely. Daily physical exams are important to catch any changes quickly. And frequent CBCs, checking those blood counts regularly, maybe every few days at first, then weekly to see if there's any response, any improvement.
Tracking the numbers.
Absolutely. And sometimes vets might even do repeat bone marrow evaluations, another biopsy down the line, to see if the marrow itself looks like it's starting to recover.
Right, to see if the treatment is working at the source. Are there any ways to prevent this or avoid it?
Well, complete prevention is tough since the cause is often unknown. But the sources mentioned a few things. Castrating cryptorchid males, those with undescended testicles, removes the risk of certain estrogen-producing tumors.
Oh, okay, that makes sense.
Keeping vaccinations up to date is crucial to prevent some of those infectious triggers like parvo or FLV.
Basic good preventative care.
Exactly. And for animals getting chemotherapy or radiation, careful monitoring with regular CBCs is vital. It allows vets to potentially catch bone marrow suppression early and adjust the cancer treatment if needed.
So, being vigilant in high-risk situations, what are the biggest dangers, the main complications to worry about?
The sources really highlight two major ones, sepsis and hemorrhage.
Sepsis is overwhelming infection, right?
Yes, a severe body-wide infection that becomes life-threatening. It's a huge risk with so few infection-fighting white blood cells.
And hemorrhage.
Uncontrolled bleeding.
Mm.
Because of the extremely low platelet counts, the body just can't form clots properly. Even minor injuries could potentially lead to significant bleeding. Both are very serious complications.
They sound incredibly dangerous, which brings us to the outlook. What's the typical prognosis?
Unfortunately, it's generally described as guarded to poor.
Guarded to poor.
Wow.
So not great.
No. Recovery, if it happens, can take a very long time.
Yeah.
Weeks, even months. And sadly, many animals don't recover, even with intensive treatment.
That's tough to hear.
It is. However, the sources did mention that spontaneous recovery can happen sometimes, especially in younger animals. It's not common, but it offers a small glimmer of hope.
A small glimmer. Okay, so wrapping this up, Aplastic anemia is this serious condition where the bone marrow essentially shuts down production of blood cells.
Right, a failure of that blood cell factory.
The cause is often a mystery, but we know infections, a whole range of drugs and chemicals, and maybe the immune system itself can be triggers.
And diagnosis relies heavily on ruling out other conditions and often needs that bone marrow core biopsy to see the fatty replacement.
Treatment is tough, lots of supportive care, maybe cyclosporine, but the overall prognosis is quite serious, guarded to poor generally.
That sums it up well. It's a complex and challenging condition.
It really is. Thinking about all those potential causes, viruses, common medications, toxins, the immune system, it really makes you think, doesn't it? It raises this bigger question for you, the listener, to ponder. What does this extreme vulnerability of the bone marrow tell us about how interconnected everything in the body is? How things we might not even connect can impact such a basic, vital function like making blood.
Yeah, how fragile that balance can sometimes be. It's definitely something to think about.